Hello, everyone. I'm Dan Toner, the health insurance broker for GTS. I'm here to talk about open enrollment for 2025. You may not know, or you may know that the renewal for the health plans is April 1st of every year. We take that time in mid to late February to look at the market, look at all the carriers, and I meet with the management team. And happy to say we're not going to make too many changes. We're going to keep the two remaining Oxford health plans. Oxford is owned by United Healthcare. There'll continue to be a 50% contribution for the single rate. The employees will pay the difference, and if you want to add a dependent, there'll be a cost to do that. There's not that much change in coverage. We're going to go over that in a few minutes. The company is going to continue to offer a dental plan. However, we're going to make a change to Delta Dental. We got a better benefit package with Delta Dental. Nothing wrong with United, but we just got a better deal. So we're going to change the dental to Delta. And the company is going to continue to give you $15,000 of term life insurance and continue the vision plan where the company pays for your single rate. So the company pays for your life insurance, your dental and vision as a single, and then you could add dependents. On the medical, they pay 50% of your single rate, and then you can add dependents if you want. Going over my memo here, I have the 2024 plans right here. I'll blow this up a little bit. When you'll be given a selection sheet. We'll go over in a few minutes that has a little bit more detail. You'll also be emailed an SBC, which stands for Summary of Benefit Coverage, with the full details, like a 10 to 12 page summary on each plan. Option one, couple of things that are common with both plans. You are using the Oxford Freedom Network. That has not changed from last year. That is Oxford's largest network in New Jersey and New York. Just note that because they're owned by United, if you need to see doctors outside of New Jersey and New York, like Connecticut or Pennsylvania or Florida or California, you can use the United Healthcare Choice Plus network. So it is a national allowance of providers that Oxford provides. Doctor copays have not changed. 25 is your primary care doctor, a PCP, and 75 is a specialist. This little DW just means the deductible is waived. That means you simply pay the copay. When you go to an urgent care center, it's a $50 copay. That is a lot different than if you go to the hospital, where it's AD after the deductible. So if you go to the emergency room in a hospital setting, it's gonna be part of your deductible first, and then you have a $300 copay. If you go to an urgent care center, it's a $50 copay. There is no change in X-ray and lab work. Those are free. The deductible's waived. That's the same as last year. And there's no change in pharmacy. Both plans have a $10 copay for generic, a $35 or $75 copay for name brand. 35 is the preferred, 75 is non-preferred. If you're taking a specialty medication, usually those cost thousands of dollars a month. There's a $250 copay. These are monthly copays for a 30-day supply. Number one, they have a mail order service where they'll save you a copay. So if you're using a maintenance drug every month, talk to the doctor, talk to the pharmacy, get a 90-day script, see if it can be sent to you through mail order. That will save you one copay every 90 days or 4 copays a year. So take advantage of the mail order. Now, the fundamental difference between options 1 and 2 is really the treatment of hospital, like if you're staying overnight, outpatient surgery, or even inpatient surgery, and then imaging and an emergency room, and imaging, which is MRIs, CAT scans, and PET scans and CAT scans. They are part of the deductible. Last year's deductible was $2,500 on the base plan. Now it's $3,500. The buy-up plan was a $3,000 deductible, and now it's $4,000. So basically, we increased the deductible $1,000. The first plan says all your hospital, surgery, imaging, emergency room, you have a $3,500 deductible. You owe 30% of the bill, but you cannot spend more than $8,150. That is your worst case scenario for the whole year. If you happen to hit that number, you have 100% coverage for the rest of the calendar year. On the second plan, if you have hospital surgeries and imaging, you will owe a $4,000 deductible and then nothing. Now, the out-of-pocket is $8,150 because it includes copays to the doctors, but for many, you won't come anywhere near that $8,150 out of pocket because of how rich this plan is, meaning you owe those zeros after the deductible for hospital surgery and like MRIs, CAT scan, PET scans. So if I had a $100,000 bill on this plan, I'd probably hit my $8,150. If I had a $100,000 hospital bill, I'd only owe $4,000 for it. So that's why it's a little richer plan. For those that don't anticipate hospital and surgery, save your premium and continue to be on option one. If you think you have a lot of those hospital surgeries and MRIs scheduled, I would perhaps pay a little more out of my paycheck to get option two. And I kind of wrote that out right here. You're welcome to call me if you have any questions. My contact information is in here. Any deductions that come out of your paycheck on a Section 125 plan, pre-tax. This is a reminder on the Oxford site. You go into My UHC and log in as a member where you could see your claims. This is how you look up doctors. Dental. My deltadentalnj.com is the website. We are changing carriers. A couple things. Get nothing wrong with United, but we're improving the maximum. So the way dental works is you're getting 100% coverage for your checkups, cleanings, and exams. You pay zero. You're getting 80% coverage for basic services, like fillings. You pay the 20%, and for the major stuff like crowns, root canals, you're paying half. They're paying half. If you're using their PPO network, you get a $3,000 maximum, which is $1,000 more you got with United. If you're using their Premier network, which is the largest in New Jersey, you're getting $500 more than you did with United Healthcare. This is a copy of the benefit summary to explain that. Again, PPO, you're getting the $3,000. The Premier, you're getting the $2,500. No change in the vision as mentioned before. So that is single rate is paid by the company. That's the summary. How you make elections is you put your name on this sheet of paper. Everyone will be provided a selection sheet. Here's the Oxford, the two plans that we discussed. There's your contribution per paycheck. If you are single, you check off which plan you want. If you're declining, you check off here. If you're adding a spouse, that's your contribution. If you're adding you and children to the plan, it's one rate no matter how many kids you have. Children are covered to the age of 26. And if it's you, spouse, and children, you would check off this box. This is the dental. Remember, the company pays for your single rate. You would add cost to add dependents. And same thing with the vision. So we need you to basically print those three sheets, tell us what you want, and provide them to Jennifer by the end of open enrollment. This is my contact. This is Oxford's customer service. This is me, Dan Toner, and my team, Amanda and Leslie, my support. I'd like to give reminders. So this is all the services that you can get from United Healthcare, the telemedicine. This is Delta Dental, how to log in to their MySmile on their download their app or go online. And once you get your ID number from our office, some of the features, and then just some disclosures. Remember, we have a Section 125 plan and some announcements about HIPAA and COBRA and things like that. So that's all I had. Again, you have my contact information. You're welcome to contact me, and I will see you guys on Friday, the 21st, for our open enrollment call.